I know that because I have paid hospital bills for people in the US who didn't have health insurance, relatives, friends who didn't have health insurance and ran into some, including my own sister who had an accident and didn't have health insurance and had to pay health bills in America from here. So that she could actually take time off work and get sort of care. Because if you don't, either you work, or if you don't work, you can't afford care. And there's a bit of a problem. So you get to see how dysfunctional even a system of a very wealthy country can actually be. It is also it can be extremely divisive. It can be extremely divisive. Those of you who followed the healthcare US, the conversation around Obamacare was extremely divisive. Why was it so divisive? It's because you have got so many vested interests. You've got big pharma, pharmaceutical companies, because this is an important and necessary thing. It is easy to make huge profits if you have life-saving drugs, and you are not particularly ethical. You can charge huge amounts for it, and people will have to pay. And you have very spectacular cases of that nature in many countries. It has doctors and healthcare professionals who look at one way of doing things. You have politicians, you have community, you have communities of faith who have different world views about, like, Roe versus Wade, which is quite topical at the moment. So it's an extremely emotive and can be an extremely divisive issue. So and in this country also we have had our conversations around health workers and the county governments and industrial relations issues, and between private and public, and between curative and preventive, and all sorts of things, and various people. Everybody feels very, very strongly because healthcare, their health is very, very important. So, building a healthcare system, a good healthcare system, requires a level of coming together that is probably more unusual than many other things. Hence the statement, why I found the statement by the Singaporean foreign minister about combining the three things: healthcare, social capital, and governance. I think because you have to have a lot of social capital so that people can do the give and take that is required for you to arrive at a solution. For the last year and a half or so, we have been involved in having that kind of conversation internally, doing a lot of thinking, going back and forth, consulting various people. And we think that we have framed an outline of a vision of a healthcare system that can work for us.
Iwapo unapenda habari nazokuletea, basi subscribe kwenye channel hii ili uwe unapata uhondo kila wakati. Shukran.